Hi, this is Dr. Nagarjuna Reddy. Today we have Dr. GV Nagarjuna Reddy, Senior Consultant ENT, Head and Neck Oncologist with us. What are the targeted therapies and immunotherapies for head and neck surgery?
So, head and neck, there recently a lot of literature on immunotherapy and ఇంతకుముందు కూడా ఉంది. But newer applications where we are trying upfront, especially locally advanced lesions లో neoadjuvant immunotherapy combinations try చేస్తాం.
క్యాన్సర్ అనగానే ది ఎండ్ అనుకుంటారు. యాక్చువల్లీ ద పేషెంట్ కంటే కూడా ఎక్కువ ద ఫ్యామిలీ ఇబ్బంది పడుతూ ఉంటారు. ద కేర్ గివర్స్ చాలా సఫర్ అవుతూ ఉంటారు.
పేషెంట్ ట్రీట్మెంట్కి రావటం ఎంత ఇంపార్టెంట్, ఒక ఎమోషనల్ సపోర్ట్, ఫిజికల్ సపోర్ట్ ఇస్ ఈక్వల్లీ ఇంపార్టెంట్.
స్నోరింగ్ అంటే అందరూ నార్మలే కదా అనుకుంటారు.
Snoring is nothing but sound. When we are breathing, and especially when you are sleeping, it's a loud sound produced by obstruction anywhere in the upper airway.
But what if only there's mouth breathing?
Mouth breathing is because kids have this adenoids hypertrophy.
This is Dr. Nagarjuna Reddy. Today we have Dr. GV Nagarjuna Reddy, Senior Consultant ENT, Head and Neck Oncologist with us. Let's welcome him. Thank you for joining us, sir. How are you?
I'm good. How are you?
I'm good, thank you. So can head and neck cancers be treated without removing any part of the organ?
అట్లా అని చెప్పలేం. దెల్ బి స్మాల్ సర్జరీ, ఎస్పెషలీ హెడ్ నెక్, టంగ్, జా, buccal mucus. The small portion will be removed.
Even in the stage 1?
Yes. Stage 1 also. Generally head and neck cancers lo surgery is the best option. For the tongue and oral cavity, a small portion will be removed. Tongue, cheek అనుకోండి, even on the mandible. But it is not causing any deformity. అంటే మనకి బయటికి కనిపించే అంత ఏమి ఉండదు. It will little bit of slag of 1 or 2 words. ఒక టంగ్ మీద ఎస్పెషలీ లాట్ ఆఫ్ పీపుల్ కమ్ విత్ నాకు తినడానికి వస్తున్నా, మాట్లాడొచ్చు అంటే ద మూమెంట్ యూ డూ సర్జరీ ఇన్ ద సేమ్ డే ఇట్సెల్ఫ్ దే కెన్ టాక్ అండ్ ఈట్.
ఓకే.
సో ఎస్పెషలీ stage 1, ఓన్లీ థింగ్ దే విల్ బి స్మాల్ డెంట్ ఆన్ యువర్ టంగ్. సో దట్ విల్ నాట్ డూ ఎనీథింగ్. అంటే దానివల్ల అంత లాస్ ఏమి ఉండదు.
ఓకే.
బట్ యూ కీప్ ఇట్ విత్ ద ఫియర్ దట్ అదేమో నా మాట్లాడలేమో, తినలేమో, ఇట్ విల్ గ్రో అండ్ ద మోర్ పార్ట్ హ్యాస్ టు బి రిమూవ్. And with reconstruction now, we have a wonderful reconstruction advancements. We do reconstructions, especially tongue, mandible, jaw. కొంతమందికి అసలు చేసినట్టు తెలియని కూడా తెలియదు. So yes, technology is advancing, so we can utilize that in a good way.
So reconstructive surgery possible antar after removal of tumor?
It is mandatory now. It's not possible. It is a part of surgery.
Okay.
సో ప్రీవియస్లీ ఒక 10-15 years బ్యాక్ in the సర్జరీ చేసినామా, పార్ట్ తీసేసినామా, దెల్ బి హ్యూజ్ డిఫెక్ట్స్ లైక్ జా కనిపించకుండా, జా లేకుండా, టంగ్ లేకుండా. బట్ దే యూస్ టు లీడ్ దేర్ లైఫ్. నౌ యాజ్ ఐ టోల్డ్, ఇట్స్ అ చాప్టర్ ఇన్ ద లైఫ్. It's not the end of life. We are trying to achieve the equal good cosmesis. So we have a wonderful reconstructive surgeon and team with us. They do a wonderful job. The moment we resect, the moment patient comes in the OPD, we plan. I plan that this part is, I'm going to take out this part. So how do we go about it? Then he sees the patient, what is his profile, what is his other multiple factors, and we sit and discuss. Itla reconstruct cheddam, he'll do good, his functionally. Our prime priority is his recovery. He should recover faster. He should get back to his eating and swallowing immediately. Cosmesis. At the same time, previously 1, 2, 3. Now we consider all of them at a time. And make sure that we can do the best for them according to the patient profile, patient profile. So yes, reconstruction.
They do not lose even their confidence also.
100%. Look, so there are professional multinational company owners where when I was in my training, we have operated, I don't want to, but they've been good, like within 1 week, 10 days.
Wow.
Good, lovely, doing back to their lifestyle and job. So yes, it's a part of, now that's what I was going to tell. It is radiation, chemo, these are all,
is also part
everything is a part of treatment. You cannot remove and say that idi kaadu ani. Cancer is a teamwork. It's not only me sitting there doing my job. It's a surgeon, it's a reconstructive surgeon, it's a medical oncologist, radiation oncologist, nuclear medicine, swallowing therapy, speech therapy. There is a physiotherapist. It's a hell number of professionals coming together for a patient so that he goes back to his normal lifestyle. So it's a multidisciplinary thing. That's the thing. We all work in a team. We work as a team. discuss, and we approach a patient as a team.
Okay.
Even I might be the face for this patient,
Hmm.
some other person might be the face of the treatment for the other patient, but
Okay.
it's generally a team that's behind.
What are the targeted therapies and immunotherapies for head and neck
So
surgery?
head and neck, there recently a lot of literature on immunotherapy, and ఇంత ముందు కూడా ఉంది, but the newer applications where we are trying upfront, especially locally advanced lesions లో neoadjuvant immunotherapy combinations try చేస్తున్నాం. ఇంతకుముందు ఆర్ ఈవెన్ ద present situation also, especially in locally advanced or metastatic lesions, where we try immunotherapy to decrease their suffering, prolong their lifestyle, the quality of life for few months to days. But with advent of new targeted immunotherapy drugs, we are trying to use it upfront in some locally advanced lesions so that we can downstage the tumor and మీరు చెప్పినట్టు పెద్ద డిఫెక్ట్స్ కాకుండా చిన్నగా హౌ కెన్ వీ టేక్ అవుట్ కన్జర్వేటివ్లీ అనేది వీఆర్ ట్రయింగ్ ఇట్. సో దే ఆర్ గోనా బి మోర్ ఆఫ్ ఇట్ ఇన్ ద ఫ్యూచర్ రాదర్ దెన్ నౌ.
క్యాన్సర్ అనగానే మనం ఇందాక మాట్లాడుకున్నారు ది ఎండ్ అనుకుంటారు. యాక్చువల్లీ ద పేషెంట్ కంటే కూడా ఎక్కువ ద ఫ్యామిలీ ఇబ్బంది పడుతూ ఉంటుంది, ద కేర్ గివర్స్ చాలా సఫర్ అవుతూ ఉంటారు. సో వాళ్ళకి ఏం చెప్తారు మీరు?
మోస్ట్ ఇంపార్టెంట్ థింగ్ ఫర్ క్యాన్సర్ ట్రీట్మెంట్ ఆర్ అ పేషెంట్ అనేది కేర్ గివర్స్ ఆర్ రియల్లీ ఇంపార్టెంట్. వాళ్ళు చాలా ఇంపార్టెంట్. ఎందుకంటే ఇఫ్ దెర్ ఇస్ నో ప్రాపర్ సపోర్ట్ దే విల్ బి గాన్ ఇన్ డే వన్. ఇఫ్ యు ఆర్ నాట్, అంటే మనం పేషెంట్ ట్రీట్మెంట్కి రావటం ఎంత ఇంపార్టెంట్, ఒక ఎమోషనల్ సపోర్ట్, ఫిజికల్ సపోర్ట్ ఇస్ ఈక్వల్లీ ఇంపార్టెంట్. So
not only financial,
yes, financial 100%, but emotional and physical support, because at there will be stages where he'll be really emotionally sick, whether I should go ahead, not go ahead, cheyala avudda indi ani. If finances set apart, if finances are taken care, still there will be a thing, what would I look like, what would my children's, how would I appear to my children's kid, family, father, friends, this so there's an emotional stress for the primary caregiver, whether it be a wife, brothers, father, son, whoever it is. And there will be stages where you cannot get up also. Okay. Maybe very weak, you cannot get up to eat, you cannot, so they have to constantly motivate you. Every 2 hours kontamandiki feeds ivali, every 3 hours feeds ivali vallaki, they have to change their clothes, sometime even
dependency common.
Yes, dependency untundi initial, not depends on the stage again. Okay. Early stage cancer is very almost like minimal. But emotional part of it, yes. But in advanced stages, sometimes there will be phase of 1 week, 10 days will be very, very weak, especially while receiving chemos or radiation. So there will be dependency. So they have to be very patient, and there will be especially caregiver burnout untadi. వాళ్ళు పొద్దునుంచి చేస్తూనే ఉన్నాం ఇంకా అయిపోవట్లేదు అనిపిస్తుంది. అంటే దే విల్ బి డూయింగ్ లైక్ ఎవ్రీ 2 hours they have to give some feed. They have to do their daily chores, they have to manage their office. Depends, like they are working, it becomes very difficult. So you cannot apply for leaves, they'll be restricted. So there'll be hell of a burnout. So sometimes they do also come in, sir inni rojulu emaitundi aitada kada. They get frustrated saying this, like are we done, is it there is no chance, we are done annattu. So that is again a very common and important thing, which there's a gap in that in our society when compared to the Western society. We'd have a huge families and stuff, but again still there's a caregiver burnout gaps. So probably there are many what we call as people are coming out with these slowly coming out with
this groups, they are forming hospital lo kuda.
Yes, caregiver group and survivorship groups and etc. So but again it takes time. Not it doesn't happen a single day, but so a lot of things going on for them.
సో ఎట్లాంటి లైఫ్ స్టైల్ మోడిఫికేషన్స్ చేస్తే లైక్ హెడ్ అండ్ నెక్ సర్వైవల్స్కి కానీ అండ్ రాకుండా ఉండాలని కొందరికి ఉంటుంది.
రాకుండా ఉండాలి అంటే the moment human is born there are chances, and that's what I was telling. But yes, not resorting to the tobacco usage if you are a high risky option. You've been using tobacco, you want to quit it. We as a head and neck oncologist, we do help our patients. We have psychiatrist colleague who talk with them. We have nicotine de-addiction, especially clinics where we try to de-addict them. And if the person decides to stop these high risk behavior, yes, the chances goes down. So if you stop smoking or use of tobacco today, the effect lasts for next 10 years in your body. So that's what I tell every one of my patients, especially youngsters who say that I've been smoking, I've reduced. నేను తమన్ ప్యాక్ తాగినప్పుడు ఒక 5-6 తాగుతున్నా అంటే బస్ ఇట్స్ అప్ టు యూ. I'm always open. My card is here. You can call me anytime. You're a potential patient to me, but just keep a watch on it. You have to cut it down. You have to stop it. You don't cut it down. You don't do it for my sake or somebody else. You have to cut it down for yourself, because for the present lifestyle, for the present stress and food and all those stuff, this you're buying your own death. So probably tobacco and alcohol, and the accessibility to these things have increased like anything when compared to the last decade. Now even every college, uh, as per this COTPA, the Anti-Tobacco Act, college, school, institution, hospital should not have a place selling pan, tobacco and all this stuff in minimum 100 yards somewhere, but they are next to each hospital, next at the entrance and exit of college, you can IT company, everything.
Yeah.
So you can see that it's easily accessible. The accessibility to these things have increased. The number of wine shops, the access, the age, they're not checking it.
True.
I've been recently to one of my friends, some as kind of a bachelor party. We were just sitting at out. So one of the guy told, I'm just 18, but I just chucked my this thing, and he's in a brewery having enjoying his time. But that's how things work. So probably restricting yourself and probably not habituating to tobacco and alcohol products would
Good
be the
lifestyle.
needed lifestyle. That's it.
సో టెల్ మీ అబౌట్ స్నోరింగ్ అంటే అందరూ నార్మలే కదా అనుకుంటారు. యాక్చువల్లీ ఇంకా చెప్పాలంటే ఇంకా గురక రావడం కూడా ఇంకా యూనో కొందరు అదృష్టంలాగా ఫీల్ అవుతుంటారు. ఎందుకు అంటే కష్టపడిపోయినాం, దట్ ఈస్ గుడ్ నిద్ర పట్టడానికి అని అనుకుంటారు. వాట్ ఎగ్జాక్ట్లీ ఇస్ స్నోరింగ్ అండ్ ఇస్ ఇట్ డేంజరస్?
Snoring is nothing but sound. When we are breathing, and especially when you are sleeping, it's a loud sound produced by obstruction anywhere in the upper airway. సో అదే మీరు చెప్పినట్టు చాలా మంది అదృష్టం గుర్క పెట్టి పడుకుంటుండు, హీ ఈస్ లైక్ స్లీపింగ్ లైక్ హెల్. సో బట్ యాక్చువల్లీ ఇన్ టర్మ్స్ స్నోరింగ్, there's a small difference between snoring and what you are saying is snoring dangerous. Only snoring is a sound which is could be because of any deviated septum వల్ల కానివ్వండి, or something mostly nasal and nasopharyngeal airway వల్ల అవుతుంది. But generally snoring is associated in especially with the obstructive sleep apnea. So what is obstructive sleep apnea? And again, it's a obstruction while you are sleeping, which is creating the apnea. Apnea is nothing but stopping of breath. And మనం బ్రీద్ అనేది ఆపేస్తున్నాం,
ఎయిర్వే కి అబ్స్ట్రక్ట్ చేస్తుంది.
Yes, that's it. Apnea is nothing but complete pause of your breathing for minutes, seconds and whatever it is. So
ఎట్లా డిఫరెన్స్ చేస్తారు? మీ దగ్గరకు ఒక పేషెంట్ వచ్చిండ్రు, నాకు గురక వస్తుంది, నా ఫ్యామిలీ కంప్లైంట్ చేస్తుంది అని వస్తుంది.
Yes, especially lot of youngsters or lot of these recently married people come in saying that ఈ గురకకు మేము నిద్రపోలేకపోతున్నాం.
That's a movie also.
Yes, so people when they are bachelors, nobody bothers. I think they would have known, but they would have not bothered. But lot of as you said correctly, lot of recently married people have come saying that he snores like hell.
No, ఆ మూవీ చూడకపోతే నిజంగా అది అంత డిస్టర్బ్ చేస్తుందా లైఫ్ ని? No one knows.
And it happens. A lot of couples do come saying that it's bothering us. It's too heavy or too loud. So when there's a questionnaire to rule out that, it's available online. Stop bang ani, STOPBANG ani. So it's just a questionnaire, just a simple to calculate your risk, whether you do come in under the risk of obstructive sleep apnea, developing obstructive sleep apnea or not, anything. So obstructive sleep apnea symptoms allow ఉంటాయి. It's very silent disease. It's called as I just wrote a blog saying it's a ticking time bomb.
Okay.
Ticking time bomb ఎందుకంటే it is not dangerous as of now, but in next decade or in some time over a period of time, it might be a major health risk, and probably it's a silent epidemic as of now. If you take 100 people, screen them, ask them, probably around 60-70% would have this underlying symptoms of obstructive sleep apnea. ఉండే అవకాశం ఎక్కువ ఉంది చాలా, especially with these sedentary lifestyle, obese, increased abdominal girth and obesity and etc. So these are the factors. 100%. Sedentary lifestyle, yes. You have more chance of developing these abdominal obesity. Your waist to hip ratio, and your waist abdomen the more the fat deposits, it's not good for your breathing. It's like if you're lying down and sleeping, somebody gets a big rock and
Uh-huh.
keeps on your tummy, can you breathe? You cannot
No.
breathe, right?
Yeah.
So it's a breathing against resistance. So these are the risk factors, and probably we can screen a lot of people in
సో
overall.
స్లీప్ apnea అంటున్నారు. సో వాట్ అగైన్ అంటే దేనికోసం వై ద టర్మ్ స్లీప్ apnea?
So when we are sleeping lying down, because of the gravity, the airway is generally not exactly circular in limb. It's like a tube. It's like a tube, and when we lie down, it becomes a bit narrower because of our muscles కానివ్వండి, gravity వల్ల it lies and compresses. airway అనేది కొంచెం narrow అయిపోతుంది.
ఓకే.
సో అప్పుడు ఏమవుతుందంటే ఈవెన్ దెన్ ద బాడీ హ్యాస్ సమ్ మెకానిజం టు మెయింటైన్ ద పేటెన్సీ అండ్ we breathe in while we are sleeping and lying down. So itla horizontal ga aithe, side ki dirte it will be much better. Kontamandi they cannot do, they turn around like on the tummy. So what happens is, with increasing excessive deposition of fat in the base of tongue, in the neck, with short necks, with excessive abdominal obesity, the airways compress more. Meer inka weight pedte emaitadi meda meda, it's like choking on yourself. Like if I put weight on my neck, it chokes me, right?
True.
So the increase all these weights and all these, there are structural some people have structural abnormalities, mandibular prognathism antam, they have back set mandible. So the tongue fall is more, especially tongue is a huge organ, adi manam padukunnappudu it goes back, so it narrows the airway also. So all these factors play in. Some people 1 kilo berthena, they'll have a huge difference in there. So when they have apnea in the night, they have అంటే వాళ్ళ మధ్యలో దే బాడీ బ్రెయిన్ వేక్స్ అప్ సేయింగ్ దట్ బాస్ ఐ డోంట్ హ్యావ్ సఫిషియంట్ అమౌంట్ ఆఫ్ ఆక్సిజన్, గెట్ అప్ అండ్ బ్రీత్ అగైన్.
ఓకే.
సో దే చోక్ ఆన్ దెమ్సెల్ఫ్, దే అగైన్ వేక్ అప్ ఇన్ ద సెన్స్ దే జస్ట్ clear their throat and breathe again. So that cycle goes throughout multiple times in the night. So the amount of oxygen that your blood has, suppose for example we'll just take 100% oxygen blood lo undale, but when this apnea comes down, it goes to around 60s, depends, 70, 80, 90, 100 alla tagipotuntadi. Tagipoyi malla peak bongane malli your brain wakes up the body saying that boss you work again. So generally it's like system, manam just in layman terms lo to make the people understand, it's like shutting down the system.
Okay.
But when you sleep, you need to shut down the system, right? Your basal metabolic rate decreases, your heart, only essential functions for brain and heart. But when you're sleeping, your body is actually under stress, saying that there's not sufficient amount of oxygen for you. You're breathing, but you're not breathing sufficient amount of oxygen. So your brain again wakes up saying there's boss lay. So it generates a stress in the body.
And mouth breathing also comes under this.
Yes. If nasal, some people have
Nasal
bad
blocks.
nasal deviation, adenoids, tonsils, especially pediatric patient, they open mouth and breathe because they have to breathe.
True,
So ఇది
true.
close అయిపోతే God given they have mouth.
అయితే దర్ ఇస్ సీజనల్ గా కూడా జనరల్ గా ఇప్పుడు మాన్సూన్స్ ఉంది,
Yes.
లేదంటే ఇన్ సమ్మర్ టూ మచ్ ఆఫ్
Yes,
ఏసీ,
yes.
నోస్ బ్లాక్ అయిపోతుంది.
అవుతుంది. That's common.
That's
because
very common.
That's common. That's
And not a
happens to-
big issue.
Not a big issue. Like once in a while, everybody has that nose block and stuff. Once in a year, you develop a flu and stuff. But if it's occurring repeatedly, then there's something.
బట్ అసలు మనం ద పర్సన్ ఇస్ నాట్ సిక్ ఆర్ నాట్ హిస్ హెల్దీ, చూడడానికి హెల్దీగానే ఉన్నారు, బట్ వై డస్ నోస్ బ్లాక్?
Nose block is again a common thing. It's an nowadays in cities, it's very common problem. A lot of people do come and say, I sit entire day in the AC and stuff. So physiologically, nose is the AC. Ante it is like temperature control of the body. The moment we breathe in some air, whatever temperature we breathe in, it goes at the same body temperature. So it takes the air, regulates the temperature, makes it moist. If it is dry, it makes it moist. If it is moist, makes it ambient for the
It
body.
balances.
So అవన్నీ కరెక్ట్ చేసి పంపిస్తుంది. So depending on the external temperature, the nose reacts. Vasodilatation, there are turbinates in the nose that dilate, that have like a sponge like tissue. అవి అవసరమైనప్పుడు పెద్దగా అవుతుంది, చిన్నగా అవుతుంది. So this cycle continues whenever like according to the environment, మనకు కావాల్సినట్టు టెంపరేచర్ బట్టి బాడీ చేంజ్ చేసుకుంటుంది. But when you're persistently in cold in this environment, people have different deviated septums, especially Asian population has more septal deviation compared to the Caucasians, Westerners kana. So ento konta deviation untundi, and with all these stuff, ACs and having cold drinks and cold water and stuff, there are chances they have the stuffy nose more.
What about pediatric patients? Generally, they have like AC lo unnanduku ledante because of monsoons.
They have this adenotonsillitis, which is very common in
Kids or
kids,
pediatric.
very common in kids and in
Hmm.
pediatrics, and that's the way they acquire immunity. Any person, even
Hmm.
we had it when you
Hmm.
are kids.
Is it like dangerous? They have to. I mean, ante podcast చూస్తున్న వాళ్ళకి parents కి especially they need to act upon it.
Yes, they need to act upon it if it's problematic to them.
Hmm.
Ante there are few kids where it is every alternate week they have this, or every monthly once, every 2 months kosari sore throat వచ్చి fever వచ్చి tonsils పెద్దగా they cannot eat, they cannot swallow, they're always running nose.
Nose.
Always they have they're sick, they're not they're always nose block ఉంటుంది, ఎప్పుడు సరిగా తినరు. Every alternate month there's like some days he do good, like again he goes, the trough goes down, like peaks laga itla waves laga.
But what if only there's mouth breathing?
Mouth breathing is because kids have this adenoids hypertrophy, and especially some
That's
kids
normal.
have bad, no, it's not normal always.
Okay.
If they have persistent nose block, it's not normal. We are obligate nasal breathers అంటే మనం
Always.
always
ఎప్పుడు ఉండదు.
ఎప్పుడు ముక్కులోంచే గాలి తీసుకోవాలి. But especially people in the city and urban area nowadays are having more incidence of these adenoids. ఎందుకు adenoids hypertrophy అంటే with changing lifestyles, excessive sanitization, we are not exposed to what is called as a normal bacteria, normal flora. So everything, body is reacting too much to those, and there's excessive hypertrophy of these adenoid glands. And environmental pollution, yes, that's the number one culprit, I can say. So adenoid hypertrophy, adenoids is like a gland behind the nose which takes up the viruses that come and water particles that come and recognizes, shows it to the immune system, boss, this is virus, ఇది A B C D ఇవన్నీ నువ్వు గుర్తుపెట్టుకోవాలని. But when the body is reacting too much, they swell up like hell, and the entire nose block అయిపోతుంది. అప్పుడు ఏం చేస్తుంది, పర్సిస్టెంట్గా మౌత్ బ్రీతింగ్ అయిపోతుంది, and they just sit like this, they breathe, and they'll be having
kids especially,
and people who are having these lots of ice creams and diet lifestyle changes అయిపోయినాయి, so they'll have chronic mouth breathers will have other issues. They have tonsillitis because of dryness, pinched nose, chronic over a period of high arch palate, teeth crowding అయిపోయి, they'll have what we call as malaligned teeth and stuff
because of mouth breathing.
So again, this last 1-2 decades, this problem has grown into like a crisis, massively. Okay. With urbanization, pollution and stuff like, yes.
So ఇందాక మీరు మాట్లాడుతున్నప్పుడు టాన్సిల్స్ అన్నారు కదా.
Yes.
సో every tonsil we need to surgery చేయాల్సి వస్తుందా? You need to act upon it.
I don't think so.
Is there any size?
Yes, the size as well as there are criteria, like there are 2 chronic tonsillitis as well as tonsils causing obstructive sleep apnea in pediatric population.
Okay.
So I'm speaking about pediatric population. And if they have chronic, in చెప్పినట్టు every alternate month, ఒక yearలో 5 to 6 episodes of fever, having a loss of school of 1 week, weight gain లేదు, తినడానికి ఇబ్బంది, they are sick. So it's not good for chronic illness, is not good for. Previously it was also linked to rheumatic heart disease, but now vaccinations, with the vaccination stuff, it has gone down. But again, chronic ill health will bring down their overall well-being, their overall growth, their what you call as eating behaviors. So obviously such patients, yes, 100% go ahead with surgery. If they are chronically affected with chronic tonsillitis, infections outunay, fever వస్తుంది, they're affecting their other is pediatric sleep apnea, as we say. Patients having huge tonsils, huge adenoids, even with mouth open breathing, they cannot breathe properly, they have bedwetting severely. ఎంతసేపు పడుకున్నా they are not having
why how is it connected with the bedwetting tonsil?
It's like what you call as I will just leave it. So I'm not able to recollect. So chronic mouth breathers and huge tonsils and adenoids they sleep even for 8 to 10 hours. They'll not have deep sleep, they'll be always moving in the bed, they'll not be active, there'll be some kind of fogging, as adults do have. Attention deficit hyperactive disorders, there are chance of having all those concentration difficulties, lack of attention, ఇవన్నీ ఉంటాయి. So all those patients, yes, 100% they are indicated for surgery.
What about recurrence?
Tonsils recurrence we take out the tonsil. Nowadays with latest technology we have plasma and like coblation, what we call. There are two techniques. Some school of thoughts are different. Some people take out the entire tonsils. It's a bit painful. Some people just do an entire capsular tonsillectomy. It's just melting a part of tonsil that is popping out. So there are two techniques and there are different schools of thoughts. Both work well, depends on the patient selection ante. So yes, they don't grow back. But yes, they are if tonsil కొంచెం tonsil ఉంచేసామంటే there are chances of infection in the future. Not on all patients, but some people might have it. Adenoids, yes, we remove it with plasma. We take it out entirely. The latest technology, we like flush it off. So I don't think so. If done properly, no scar. It's endoscopic through the nose, through the mouth. So nothing, no external scar. I think recurrence chances are very less. They do happen in few cases. I'll not say zero, but again, yes, they do happen in very few cases. It's addressable. It's like a daycare surgery. Nothing, not painful. So it can be addressed.
సో స్నోరింగ్ గురించి మనం మాట్లాడుతున్నప్పుడు దాన్ని సీరియస్గా ఎప్పుడు తీసుకోవాలి?
So as I said, snoring could be one of the symptoms or underlying or a masquerading factor of obstructive sleep apnea. So yes, if it is disturbing your partner, yes, 100%. Second thing, it's causing a sleep disturbance for you. You're not able to have a active morning. You have daytime sleepiness. It's foggy. You're not active. So obviously it might be associated with sleep apnea. So you are agitated, irritable. While some people, a patient recently I had like few months back, he's working in a good company and he said that when I am driving the car, I sleep off. So that's a dangerous thing. So that's the reason he came in, because అంత డే టైమ్ స్లీపింగ్నెస్ వస్తుంది. నేను డ్రైవ్ చేసుకుంటూ పడుకున్నా. I have to drive around 25 kilometers a day for work. As an executive, basically office work, nothing much, but again, so that could be life endangering. Sudden accident, they can meet with any accident. So yes, all those could be underlying causes.
And does it happen only with old age people?
No, not at all. Especially it can be as common as like 20 years nunchi start. It could be like anywhere in between, like 60, 70, 80 years. So older age, yes, it would be, there will be some, but I think present generation these days, it can affect anyone.
అయితే snoring that can affect on heart health, even on blood pressure.
Yes. So what happens is this snoring and
అంత సీరియస్ గా తీసుకోరు కదా అసలు.
తీసుకోరు. సో అదే ఇట్స్ అ టికింగ్ టైమ్ బాంబ్. ఇట్ విల్ నాట్, దాని టైం వచ్చినప్పుడు వెళ్తుంది ఒకేసారి. సో it will have effects on your lung and heart. It causes cor pulmonale, ante it increases the pulmonary pressures as well as right heart. It affects the right side of the heart more. Right heart failures ki guraitar. So ade cheptuna, what happens is it accumulates over a period of time, and when the period comes in, you'll have all these metabolic issues. You'll have obesity, you'll have neurological issues. One patient, like one international patient from across the African continent, he came. He said that I cannot lie down. He cannot sleep. And at the moment he lies down, he goes into sleep because he's so lack of sleep. But the moment he sleeps, he wakes up. So we had to perform some test called DISE, drug-induced sleep endoscopy. And you should see him ante padukolepotno. The minute he sleeps, he's choking on himself and getting up. So that bad, and that
అంత
severe unde. So and it is accumulated over a span of like 10-15 years. So it will show its true colors after a few years. So it's a ticking timer. It's a silent epidemic. So you should recognize early symptoms. You feel the snoring could be just snoring itself. It might or might not be associated with obstructive sleep apnea, but yes, you should get it evaluated. It's always better. It's nothing fancy. It can be done in a sleep study, essentially a sleep study and a clinical examination. Ante you are at a risk kada and doctor చూస్తారు. అవసరం అయితే they will prescribe you a sleep study. And when you're sleeping, your blood pressure, your oxygen saturation, all these things will be measured, and we generate a report saying that
there are machines and all.
Yes, there are machines. Yes, so it's easily available. You can do it at home. You can do it at hospitals with proper labs, at different levels of it and different level of accuracy with it. But it will just give us a rough estimate. Kanisam.
So snoring ఉన్న వాళ్ళకి once they come to your clinic, treatment ఎట్లా ఉంటది?
So,
The proper diagnosis also.
so proper
Okay.
diagnosis is, as I said, first the clinical examination and doing an endoscopy. OPD basis endoscopy చేస్తాము. We screen them whether actually they'll fall into obstructive sleep apnea risk category కాదా. And we ask for their detailed history. If the symptoms are there, we suggest them a sleep study test.
Okay.
And depending on sleep study result, again we do a drug induced sleep endoscopy just to be sure, just to check what is the part of obstruction. అంటే it will give us a hint, but it will not decide the treatment 100% ఇదే చేయాలని. But there are few and we do DICE, drug induced sleep endoscopy. What we do is we give them anesthetic drug and they sleep. When they sleep, we see what is the part obstructing, causing that snoring, obstruction ఏదో చూస్తాము. And we then counsel them whether it can be surgically corrected. He's a surgical patient or a non-surgical patient. Patients who have surgical issues which can be corrected, we do that surgical correction stepwise. It's a multi-level surgery. అంటే nose-లో ప్రాబ్లం ఉండొచ్చు, throat-లో ప్రాబ్లం ఉండొచ్చు, base of tongue, multiple sites can be there. So we do a graded procedure for them and we give CPAP sometimes. If patients are not fit for surgery and they are not surgical candidates, CPAP. They don't want surgery again, we give CPAP trial. CPAP is again a machine which produces continuous pressure and supplies that extra oxygen they're missing.
Okay.
But there are issues with that also. Some people use it very nicely ఒక 1 week 10 days because mask పెట్టుకోవాలి, పడుకునేటప్పుడు ఒక మాస్క్ పెట్టుకోవాలి. So it pushes, that mask becomes uncomfortable. There are different things now with that, masks అని, nasal prongs అని. There, and the prime important thing is we ask the patient, do you really want to like go for the treatment, because most of the things have to be done by them. Surgery is the only part where we act. Rest of the thing and CPAP అయినా కానివ్వండి, lifestyle changes. Most important is lifestyle changes.
ఎట్లాంటి చేంజెస్ లైక్?
They have to cut down their sugars, they have to maintain their BMI. The most important thing is if most of the patients are out of BMI, they'll be obese, morbidly obese, ఆ కేటగిరీలో ఉంటారు. If their weight by height ratio doesn't fall less than, like it should be between 18 to 23 for the Asian population. If they are not in that, 100% they have to do exercise, they have to cut down their carbs, sugars, whatever it is. So they have to maintain a physical healthy lifestyle. That's most important thing. So I ask them, you are committed to that, then I'll be happy to operate or happy to give you any treatment. Because if you don't do your part, even if I do the surgery, even if I give you CPAP, they're going to be almost no result. So the chances of failure, especially with this treatment, in this disease spectrum, is more. And the patient first initial 1 month, 1 year, మేము చేసేస్తామని they hit out the gym, they do the running, everything. 1.5 2 months తర్వాత done. They'll be again back to square. So people who have successful treatments are generally sticking up to their lifestyle for lifelong. అంటే ఇది ఒక్క రోజు ఒక 6 నెలలు చేయాలని కాదు, they have to stick to it for the lifetime. That's it. So that's the most important thing. I ask my patient, your role is 80%, my role is 10 to 20%. That's it. So if you are ready to do your 80%, I'll be happy to help you with the rest of 10 and 20%. So that's how and there are multiple new things. There are hypoglossal nerve implants, there are many other things which are coming up. Maxillomandibular advancements, especially with people with maxillary and mandibular issues, prognathism. We have, it's again a team approach. Not only the ENT surgeons, pulmonologist, ENT specialist, maxillofacial people, plastics, everybody come together and we decide, especially complex cases, we decide how to go about it. So just I might be the face of this for this patient. Some patients land up with our pulmonology colleagues, so we send back and forth to get each other's advice and do that treatment.
Thank you so much. Thank you for your insights, sir.
Thank you. Thanks a lot.